Hello everyone. Today we are going to discuss about hypertension. As we have already known that this is very common disease around the world. Together with diabetes mellitus, they are almost the most common non-infectious disease we are having around the globe. So we are going to dive into the topic. Actually, we are going to be starting with the normal blood pressure. What is blood pressure actually? That is the definition of blood pressure before we dive into the disease, because the hypertension is disease. So we have to know what is normal blood pressure, and then that is the definition of blood pressure. So the definition of blood pressure is actually a kind of the force that is exerted by the moving blood inside the blood vessel on the wall of the blood vessel. For example, this is a blood vessel like this. This is a blood vessel. So when the blood is moving inside the blood vessel, so the blood is going to be exerting a kind of force in the wall. This is the wall of the blood vessel, in the wall of the blood vessel. So the more the force that is exerted by this moving blood inside this blood vessel in the wall, so the more the blood pressure. So that is it. The force that is exerted by the blood on the wall of the blood vessel is called the hypertension. It's called the blood pressure. So the hypertension, when this force is exerted more and more to beyond normal, that's what we call the hypertension. That is hyper. Then that's it. So that is it. So now we saw the definition. So now we are going to see normal blood pressure. The normal blood pressure is actually a kind of, there has to be normal BP. So for normal BP, for someone to be regarded as having normal BP, he has to have less than 120 systolic millimeter of mercury over less than 80 millimeter of mercury. That is on the diastolic side. So for a person to be regarded as having normal blood pressure, but someone can has a kind of elevated blood pressure, but he is not regarded as hypertensive person, which is called elevated BP, when he has a kind of 120 to 129 all over less than 80 millimeter mercury. So this one has elevated blood pressure, but he is not hypertensive. So for someone to be hypertensive, that is in stage 1 hypertensive, stage 1 hypertension, he has to have a kind of blood pressure which is 130 to 139 all over, like for example, like 80 to 89 millimeter of mercury. So this person is in stage 1 hypertension. So we have the stage 2 hypertension. Stage 2 elevated high blood pressure. Then if he has a kind of greater than or equal to 140 millimeter of mercury over 90 millimeter of mercury. So this is the division of the blood pressure. This is for someone, if here is normal, this is elevated, this one stage 1, this one is stage 2. So now we are going to see the types. We have 2 types of hypertension actually, 2 to 3. So but mostly regarding this presentation, we are going to be talking about mostly the 2. So we have 2 types. We have primary hypertension, primary HTN, and then we have the secondary HTN. Then number 3, we have the gestational hypertension. That is hypertension in pregnancy, right? Then hypertension in pregnancy. This one is not the same as preeclampsia. In preeclampsia, we also has a kind of hypertension, but this one is a kind of having elevated blood pressure during pregnancy, and then after the pregnancy, then the blood pressure returns to normal. So this means it is due to the pregnancy. That's why it is termed as the gestational hypertension. So we are not going to talk much detail about this gestational. Concern our presentation of this, the primary hypertension and then the secondary hypertension. So now we are going to dive into the number 1, which is the primary hypertension. So this primary hypertension is termed as essential hypertension. Another name is essential hypertension because it is seen in, if you can take 100 people with hypertension, 90 to 90%, 90 to 99% of the to 95% of that hypertensive people are having the primary hypertension, not the secondary one. Because this means the primary hypertension is the most common. That is accounting for 90 to 95% 96% of all cases of hypertension. So this one means it is a more common type of hypertension. So what causes this primary hypertension is actually idiopathic. When we say something which is the etiology, that is the cause. That is the cause. The cause is unknown. That is idiopathic. It's unknown. Nobody knows what causes this kind of hypertension, this primary hypertension. Only there is risk factors actually. Risk factors that may put the person at risk of having this primary hypertension. So they are not the definitive etiology. They are not the definitive cause. So number one risk factor is actually a kind of family history. If in your family someone is having hypertension, you are at risk of having this primary hypertension. Family history. Then number two, excessive salt intake. Excessive salt intake definitely can put you at risk of developing this hypertension. Then number three, sedentary lifestyle. Someone who's out exercising lifestyle. Then number four, without exercising. Then number four, we have obesity. So someone who's obesity. And then number five, age, because it is mostly seen in aged people, not in younger people, this primary hypertension. So much more there are other risk factors also. Also in women, number six, in women that are taking oral contraceptives pills. So women that are taking these oral contraceptive pills are also at risk of developing this primary hypertension. So now we are going to actually see the symptom. When these are the risk factors, now we are going to see the sign and symptoms. So mostly signs and symptoms of this primary hypertension, they are it is hardly for you to see symptom actually. It is hardly for you to see symptom. But some people, they do come with symptoms. But the symptoms, they are vague symptoms. They are like a kind of non-specific symptoms. For example, number one, he can have a headache, especially in the morning. When all the person comes to you and tell you that he's having a kind of headache in the morning, especially at the back of his head, then definitely suspect hypertension. Check his blood pressure. Then number two, he may have a kind of palpitation. He may have a kind of that is, this palpitation means a kind of awareness of the heartbeat of a person. He may have a kind of lightheadedness, that is experiencing like someone is going to pant. But sometimes people can even experience panting, can have even panting episode, can pant. This one is a kind of lightheadedness, experiencing like someone would going to pant. So some people are going to even pant. So, but these symptoms, most of the patients they don't have these symptoms actually. So that is it. And then the sign, if you check their blood pressure, it is persistently elevated, right? Yeah, that's it. Persistent. If you maybe check it twice, thrice, remain elevated while he's at rest. So these are the signs and symptoms of this primary hypertension. So that is it. So now we are going to see the secondary hypertension. Secondary hypertension. So actually, for the secondary hypertension, actually, from the word secondary, it is caused secondary to other disease. Some other diseases cause this kind of elevated blood pressure. So number one, some causes. What causes it? Number one, it can be caused due to chronic kidney disease. Someone who is chronic kidney disease. So that is why someone with chronic kidney disease cannot excrete the water he is taking. So that's why if he cannot excrete his water through urine, definitely he cannot form urine. Definitely the water will build up in his body and then elevate the blood pressure, right? Then number two, actually, someone who has renal artery stenosis. For example, this is the kidney. So this is artery of the kidney. If this artery of the kidney become narrowed, if it become narrowed, a lot of blood, only small blood can be coming to the kidney. If only small amount of blood is coming to the kidney, then small amount of urine can be made, right? So if there is small amount of urine that is made from our body, then definitely the fluid will build up in our body, stay in our body, and then elevate the blood pressure, right? So also number 3, someone who has elevated aldosterone. Someone who has a lot of secretion of aldosterone in his body, because aldosterone helps the kidney and to retain more sodium and water in your body, and then excrete potassium, right? So that's it. So as we have already known that if you retain sodium is a kind of salt, right, and water, then definitely you will elevate the blood pressure. So someone who is hyperaldosteronism, right? Then someone who also with hyperthyroidism. Someone with hyperthyroidism, that's elevated thyroid hormone, right? Because thyroid hormone can elevate almost everything in your body. It will elevate the blood pressure, it will elevate the heart rate, it will cause diarrhea, so many things actually. So that is it. So these are the some of the causes. There are more than 15 causes of this secondary hypertension, because all these diseases can cause hypertension. So since the hypertension is caused due to one of the aforementioned diseases, so this means actually it is a kind of secondary to these conditions. So that is it. So now we are going to see the signs and symptoms. So for the signs and symptoms of secondary hypertension, it depends actually what causes the disease. Each kind of specific disease has its own specific symptoms. For example, someone with chronic kidney disease, you may see him with edema, right, swelling on his body. You'll see him with hyperkalemia, that's elevated potassium level. You'll see him with hiccup. You'll see him with kind of hiccup, right? So depending on what cause. While someone with hyperthyroidism, you'll see him with diarrhea. You see him with weight loss actually. That's hypertension is associated with also weight loss. So depending on the cause. So that is it. So now we are going to look at the kind of complication actually. What are the complications of hypertension? So as we have already know that the hypertension is actually not, mostly it is not, it is silent, right? It doesn't cause symptoms, especially the primary one actually. It doesn't cause symptoms, but the complication I've seen actually. Complication as in when someone is having a kind of hypertension for more than 20 years, more than 30 years, so the complication at that time will arise, especially if he is having a kind of poor control of the hypertension. So that is it. So now the complication, number 1, someone can have a kind of stroke, that is hypertensive encephalopathy. That is, it is known as stroke. It can cause stroke because it may damage some kind of blood vessel in the brain, causing hemorrhagic stroke, right? Because hemorrhage in the brain, that is the rupture of the blood vessel. If the blood vessel rupture, then it will cause stroke. So, and this stroke can lead to, depending on what part of the brain is damaged, it can cause paralysis of the body, right? So that is it. It can cause hypertrophic cardiomyopathy, hypertrophy of the ventricle of the heart. Let us see the picture. So this is it. This is a normal heart. See the left ventricle, and due to hypertension, see how it becomes very thick. And then if it becomes this very thick, definitely this heart, without if there is no medical intervention, so definitely this heart will fail. Definitely, this heart will fail. So this heart, this complication, it may cause heart failure. So that is it. And then another another complication, retinopathy. The retina of the eye, so can lead to blindness. Retinopathy, anything that can touch the retina, then definitely that thing or that pathology can lead to blindness. That is why someone, if someone is found with hypertension, so for prevention, you have to be having a kind of fundoscopic examination. He has to be undergoing a kind of examination of his eyes, so that to be checking the retina, whether the retina is affected or not, every time, for almost every 3 months actually. So that is it. And then the nephropathy, it may damage the kidney, because most of the people are having CKD, that is chronic kidney disease, due to hypertension or diabetes mellitus. It can cause CKD. So and much more. So now we are going to see the diagnosis, how we will diagnose the hypertension. You can say someone is having hypertension when you check his blood pressure and you found out that the blood pressure is persistently elevated, you check it, for example, for the first time, you see it as elevated, you check it for the second time, for at least 3 times, it is still elevated while the patient is at rest. So definitely, you can confirm that person is having a kind of high blood pressure, especially if you trust your equipment of measuring the blood pressure, especially the stethoscope or sphygmomanometer. So that's it. So then the treatment, actually, how you will treat the person with hypertension. So actually, there are some for the primary hypertension. Actually, since you didn't know the real cause of the disease in the primary, so definitely the person has to have a kind of lifestyle changes. If he's taking alcohol, he has to stop taking alcohol. He has to stop taking alcohol. If he is smoking, he has to quit smoking also. If he is a kind of not exercising before, so he have to be exercising. So we have to encourage him exercising. So we have to also decrease salt intake. So with this, definitely the blood pressure can decrease. While for the secondary hypertension, because there are some specific diseases that cause the hypertension, then you have to treat the hypertension. So for management of the drugs that are used in hypertension, actually, the most important drug are thiazide drugs. Number one. Actually, another kind of drug, there are thiazide like clothalidone, especially the clothalidone. And also we have ACE inhibitor, that is angiotensin converting enzyme inhibitors, like lisinopril or captopril. Right. Then another kind of drug like beta blockers, like propranolol, and much more. So this is the end of this video. Okay, thank you very much.